Welcome, everyone. It's the top of the hour, so we'll get started. I'm Dia Waguespack in Houston, Texas, and I'd like to welcome everyone to today's GlomCon seminar series. Today, our talk is titled Reaching for Primary FSGS and Studying Their Disease Journey Within a Diverse Population in the USA. Today, our speaker is Dr. John Sim.
Oh, thank you. Wow, thank you for the nice introduction. Tell you a little bit about our cohort, our FSGS cohort, as I put this on, and kind of describe our cohort a little bit and what we've been doing. And all of the stuff that I'm going to be sharing today is actually unpublished data, at least not yet, hopefully. And just kind of describe what we're doing and maybe get some perspectives and insight from the group. I think that would be a lot of fun. Can you see my slide?
Yes, looks great.
Is it in presenter view or is it a regular view for you?
No, it's regular. We can see it.
Great, great. Thank you. So I'm going to go ahead and get started. Okay. So just titled it Searching for Primary FSGS because, what is primary FSGS? So we'll talk about that a little bit. These are my disclosures. I want to say that most of the work that I'm presenting today was actually funded by OTSCA. So don't have to talk to this group, but FSGS, accounts for maybe up to 40% of all, GNs, at least, as a histological lesion among GNs. And if you take it for what it is the most common GN, the related GN that causes ESKD. But the bottom line is it's a very heterogeneous terminology, and it refers to multiple disease states. So if you go with KDIGO, you've got genetic, which is straightforward, secondary, maladaptive, whatever you want to call it, pretty straightforward. And then everything else that doesn't kind of fit in, it's, undetermined cause. But for the sake of this talk, I really wanted to talk about primary or maybe immunologic, immune-mediated FSGS. So this is the outline maybe for the next 30 minutes or so that I wanted to cover, and maybe leave open for some discussion. But the first thing I wanted to do was, kind of describe us kind of taking a swing at identifying and refining a primary FSGS population. And then describe treatment patterns among a real world environment, which I'm going to tell you about where our system is a little bit about. And then describe response to immunosuppression treatment among these treated FSGS patients. And then kind of really the hot topic now is taking us, the surrogates for ESKD. And in the FSGS population, what are some predictors and surrogates for ESKD that we can look at and bank on for new drug development. So the first thing, maybe we're going to try to take a swing at primary FSGS. So I just wanted to kind of describe where we're coming from. I'm from Kaiser Permanente, Southern California. This is our membership population that we're doing the research on. So, we're in California. We're in Southern California. Let's see. And, oops. Can you see my arrow? Can you see my arrow?
No.
No? Okay. I don't know how that works. Well, I don't really need an arrow, I guess, but there it is. So, we're in Southern California here. This is the membership here of our population. So it's all the way from San Diego County up to Kern County. So we really have the southern half of California that our insurance plan is covering. So our membership within this area is very big. We have greater than 4.8 million members within Kaiser Permanente, Southern California. And that accounts for about 12.4% of the entire California population. But more than that, and so a little bit more about our environment, we're an integrated health system. And integrated by what we mean by integrated is that the physicians, the insurance, and the hospitals are all part of one single system. And our system is comprised of 15 medical centers, 235 medical offices. As I mentioned, we have over 4.8 million members, and we're integrated, and we have an electronic health system that captures everything from all three phases. And then for the purpose of the talk today, I just really wanted to mention that 97% of all of our members have their kidney biopsies performed within our system. So we do a pretty good job of capturing all our biopsies of our members.